Mr. Zilin, honorable guests and experts, colleagues and friends, ladies and gentlemen, good morning, good afternoon, and good evening. I would like to take this opportunity to give a briefing on the implementation of WHO Traditional Medicine Strategy 2014 to 2023. My presentation divided into three parts. First one is about global situation and trends. Second one is about the strategy and World Health Assembly resolutions. Last one is about implementation of the strategy and the way forward. According to the WHO Traditional Medicine report released in 2019, you can see that the 170 countries' health authorities acknowledged the use of traditional medicine, which occupy the 88% of all the WHO member states. So you can see that all the green part that are the countries with the use of traditional medicine. In terms of the national policy development and implementation, you can see in the past 20 years keep growing, and until 2018, 98 countries developed the national policy, and 107 countries established the national office in the governmental agencies. On the regulation of herbal medicines, you can see that 124 countries already that implement that regulation. And in terms of regulation on providers, 5 years ago, only 67 countries, and 5 years later, to 2018, there are 78 countries on that regulation. So these are only some examples from the global report, and you can download it in the WHO Traditional Medicine Unit website. So the countries also expressed that challenges. So through the report, so you can see, for example, the top 5 challenges. First one is lack of research data. And the second one is lack of financial support for the research on traditional and complementary medicine. Third one is lack of mechanism to monitor the safety and the practices. Fourth one is about the education and the training for providers. The fifth one is lack of expertise within the national health authorities and agencies, etc. So based on that, the challenges and the situation in the member states, WHO developed and implement currently the traditional medicine strategy since 2014 to 2023. There are 2 general goals of the strategy. First one is harnessing the potential contribution of traditional and complementary medicine to health, wellness, people-centered health care, and universal health coverage. The second one is promoting safe and effective use of traditional complementary medicine through the regulation, research, and integration of T&CM products, practices, and practitioners into the health system. There are 3 objectives and 6 strategic directions in the strategy. First objective is to build knowledge base for management through policies. 2 strategic directions under this objective. First one is understand and recognize the role and potential of T&CM and build country profile for each specific country. Second strategic direction is to strengthen knowledge base, build evidence, and sustain resources, including intellectual resource and natural resource. Second objective is to strengthen quality assurance, safety, proper use, and effectiveness by regulation. First direction is about the products, while monitoring and enforcement of the regulation also promote harmonization in the international level. Next strategic direction is about regulation on practices and practitioners, including education, training, skills development, services, and therapies. So last objective is to promote universal health coverage by integration. First direction is to capitalize on potential contribution of T&CM to improve health services and health outcomes. Last direction is to enhance that consumer education on informed choices about self-health care. World Health Assembly also adopted a resolution on traditional medicine, so that resolution urged the member states to adapt, adopt, and implement the traditional medicine strategy as a basis for national T&CM programs and work plans. Also urge member states to develop and implement working plans to integrate traditional medicine into the health services, particularly primary healthcare services, and also to report to WHO on the progress in the implementing of the strategy. The resolution also requests the Director General of WHO to facilitate member states' implementation of the WHO strategy, supporting their formulation of knowledge-based national policies, standards, and regulations, and strengthening national capacity building. Also to provide policy guidance to member states on how to integrate T&CM services within healthcare systems, and of course to provide technical guidance in ensuring the safety, quality, and effectiveness of T&CM services. Based on this implementation of the strategy and World Health Assembly resolution, traditional complementary and the integrative medicine team already working with the colleagues within WHO and partners outside WHO to include that traditional medicine in the key WHO resolutions and important declarations. For example, not only the 2014 World Health Assembly resolution on traditional medicine, also in 2017, another World Health Assembly resolution on integrated people-centered healthcare, and also in a Shanghai Declaration on promoting health in the 2030 Agenda for Sustainable Development. In 2018, there was a declaration on Astana Declaration on primary health care. And 2019, there was a World Health Assembly resolution on global action on patient safety. Another resolution is 11th revision of international classification of diseases. And also in the year, there is a United Nations General Assembly political declaration of the high-level meeting on universal health coverage. In terms of the way forward, traditional complementary and integrative medicine team in WHO will work according to the mission and function as follows. We promote and support the effective use and equitable access to quality traditional complementary and integrative medicine products and health services that are safe, integrated, and people-centered across the life course, across the care continuum, and across the sectors to contribute in universal health coverage and the United Nations SDGs. So you can see many collaborative programs we are working. So for specific ongoing key activities, you can see that on the global leadership side, we are working through several networks. First one, of course, the WHO International Regulatory Cooperation for Herbal Medicines Network. Currently, there are 46 members, including the European Union, Southeast Asia, that regional regulatory body, and South American sub-regional body. The collaborating centers currently 27, and the expert advisory panel, 6 official relations, the NGOs, and of course providing technical support to research base, strengthening the research base. So that the second category is about we are producing the global public health goods. For example, produce the standard terminology in traditional complementary integrative medicine, WHO International Herbal Pharmacopoeia, WHO guidelines on herbal medicines, WHO benchmarks for practices, benchmarks for trainings of practitioners in different traditional medicine modalities. Third category is about promoting integration of T&CM into health systems. We are reviewing the existing models of the integration at country level. We are monitoring global trends through the regular surveys and reports. We are working on digital health tools for consumer education and self-care guidelines on consumer education and MUGA. Last category, for example, we are supporting countries, including capacity building through the annual inter-regional training workshops. We are supporting through that priority countries identified under the umbrella of Universal Health Coverage Program. We are conducting studies and producing report on models of traditional complementary medicine in primary healthcare and other ad hoc country support as requested. These are some specific examples of the norms, standards, and guidelines. For example, 2017, we published WHO guidelines on selecting marker substances of herbal origin for quality control of herbal medicines. 2018, we released the guidelines on good herbal processing practices for herbal medicines. Another guidelines released on good manufacturing practices for the manufacture of herbal medicines, updated. So next one is going to be published in the coming days, called Key Technical Issues for Safe Use of Herbal Medicines with reference to interactions with other medicines. Of course, under development is the WHO International Herbal Pharmacopoeia. Other norms, standards, documents, for example, benchmarks for training, including acupuncture, anthroposophic medicine, Ayurveda, traditional Chinese medicine, Tibetan medicine, Tuina, Unani medicine, and others, still under discussion. And the benchmarks for practice covering acupuncture, Ayurveda, cupping, Nuo Thai, Chinese medicine, Tuina, Unani medicine, and also several under discussion. Standard terminology covering Chinese medicine, Ayurveda, Unani, Siddha, integration, the guidance document on TCI rehabilitative care, for example, and also WHO global report on appropriate integration into the health system. This is also in the process of developing. And of course, we are working on the report on models in PHC. So the first part of the traditional medicine chapter already released in the ICD 11 2019, and currently working on other modules. And also 2018, you know that WHO's global reference list of 100 core health indicators covering 2 sub-health indicators: traditional complementary medicine outpatient service utilization, and also pain management with T&CM medicine, traditional complementary medicine. About situation on the TCI Am to COVID-19. So you know that the COVID-19 is still the pandemic globally. So we need to work with the partners to understand better how traditional medicine system can contribute in the response to COVID-19. Many countries already expressed eagerness to contribute to information sharing and building capacity. And also that the engagement of traditional medicine in the response to COVID-19 already happened in many countries such as China, India, Pakistan, Republic of Korea, Zimbabwe as examples. They shared information with wider community for research and practice. WHO also organized several workshops for sharing that information. And the WHO African region also established a regional expert committee working in this area. So there is a need, of course, to further strengthen the exchange of information on any new achievements to facilitate the future activities. And also there is a need of knowledge and evidence to enhance capacity and promote collaboration among the member states. In terms of the information in WHO database on COVID-19 regarding traditional complementary medicine in the WHO International Clinical Registration Platform, recorded 369 on traditional medicine at the research registration. And some registrations are only for traditional medicine. Some of them are combined traditional medicine with conventional medicine. Published articles on COVID-19 regarding traditional complementary medicine in the WHO literature database. There are 2,457 articles on traditional medicine. Among these, 1,351 on traditional Chinese medicine and 1,106 on other traditional medicine. WHO is working with member states and partners. For example, we are closely working with member states through networks and many activities, and also closely working with partners through different networks, including the governmental agencies network, experts network, collaborating center network, non-government organizations with official relations with WHO or not built official relations yet. So before closing, I would like to say that countries aiming to integrate the best of traditional complementary medicine and conventional medicine would do well to look not only at the many differences between the two systems, but also at areas where both converge to help tackle the unique health challenges of the 21st century. Also, in an ideal world, traditional medicine would be an option offered by a well-functioning, people-centered health system that balances the curative services with preventive care. And last, I would like to say that WHO Traditional Complementary and Integrative Medicine Unit had already successful collaborations with the World Traditional Medicine Forum in the past years, and we will further enhance the collaborations with the Traditional Medicine Forum in the future. Thank you.